how to take history, and how to address the patient's concerns, and organize your time in counseling stations. See this.
Hello, I'm Dr. Peter, one of the doctors here. Can I know your name and age, please?
Hello, doctor. My name is John White. You can call me John, and my age is 55.
Okay, hello John. How can I help you today?
Yes, doctor. I came today to talk about PSA test. I mean the test you do to check prostate gland.
This is a valid concern. Is there any specific reason makes you think about this test in this time, John?
I saw an article in a magazine about the importance of doing this test, especially in my age, so I decided to do it if it's possible.
Actually, it is an important topic, and we will talk about this in detail, but before that, can we talk about your health in general?
Yes, of course, doctor.
Did you notice that you go into the loo more frequently nowadays?
No, doctor.
Do you have any pain when you're passing urine?
No problem at all.
Any drips of urine after you finish urination?
Nothing like that.
Okay, this sounds good. Do you have any tummy pain?
No pain.
Any fever?
No fever.
Any lumps and bumps?
No at all.
Did you notice any decreasing of weight recently?
No change in my weight.
Any change in your appetite?
I think my appetite's still good.
Did you notice any night sweating?
No, doctor.
Did you have any medical condition, like diabetes?
No chronic diseases at all, doctor.
This is very good. Any surgical procedure, for treatment or for investigations?
No, I did not experience anything like that.
Did you admit to any hospital for any medical reason?
No.
Okay, now we want to talk about your lifestyle. Is that okay?
Sure, doctor.
Do you smoke, John?
No smoking.
Any alcohol drinking?
No.
What about your diet? What do you eat generally?
I try to eat healthy food.
Do you exercise regularly?
Yes, doctor. I try my best.
Do you take any medication?
No medications.
Any allergy?
No allergy.
Anyone in the family has serious medical condition?
No, doctor.
Did you travel recently?
I hoped.
With who you live, John?
With my wife.
Do you have any sexual problems?
Nothing like that.
What you do for living?
I am an architecture engineer.
Any stress in your work?
No stress.
Thank you, John, for answering my questions. Do you have anything to add about your health before we're talking about PSA test?
I want only to talk about the test.
Do you have any idea about the nature of test?
Just a few information.
And what do you expect from today's talk?
I want to do the test if it's advisable.
This is a valid concern, John, and now is it okay to examine you?
Yes, of course, doctor.
Is it okay also to check your blood pressure, temperature, and how you breathe?
Yes, doctor.
So return to talk about PSA test. It's important test in this age for any man, and thank you that you're asking about it. First of all, the good news that we did not find any sign of prostate problem, from what you said, or from the examination. I hope this reassures you.
Yes, thank you, doctor.
So, PSA is a protein material produced naturally by prostate, but when it increases in the blood, this could mean that there are infection, benign growth, or in the worst scenarios, it could mean cancer growth.
Is this test accurate?
This is a good question actually. This test is not accurate test. Sometimes it could give a positive result while nothing abnormal. And on the other hand, it could give negative result when there is abnormal growth.
Any complications could happen if I did it?
This is also a good question, John. The problems could happen if we did further procedures, based on false positive test. Like any procedure, sometimes there's complications, so it is better to do this test only if there are signs and symptoms.
but I read that after age of 50, better to check for prostate disease by this test.
Yes, absolutely right. You're still able to do this test, but you should be aware that could lead to an unnecessary steps, like taking samples.
Is there any screening program for prostate cancer in the UK?
No, as it has not been proved that the benefits would outweigh the risks. Although, you're still able to do the test if you have any concerns.
Is the test free?
Yes, it is free for any man after age of 50. This has been changed recently.
So, if I decided to do the test, there are any advices, doctor?
You should not have ejaculated during the previous 48 hours. Should not have exercised vigorously in the previous 48 hours, as this could affect the result.
If the result come back positive, what would be the next step?
This is also a very important question. Sometimes the best step could be repeating the test after a few days. If it's still high, we could refer you for further advanced investigations, like MRI scanning, or taking a sample from the gland. If the growth is benign, usually it will treat by medications that shrink the gland and decrease the complications. Fortunately, the benign cases by far more common than cancer cases. Any further concerns, John?
What are things that I have to notice in my normal life, related to prostate?
If you experienced any difficulties with the urination, or notice fever, decrease of weight, or any abnormal swelling, you should contact us immediately. Again, I want to thank you because you are caring about your health, and please keep attending your regular checkup.
Sure, doctor. Thank you very much.
Thank you, John.